So did you grow up? Are you a New Hampshire native?
No, I grew up on Long Island. Speaking about lacrosse powers, the high school that I graduated from always had like 5 All-Americans going to places like here for college, and Navy and Syracuse and Hopkins.
Yeah.
So I know lacrosse, but I played tennis. Probably the worst social decision of my life, but.
Tennis is like boxing. I mean, tennis is one of the most intense sports because you're really playing yourself. I mean, in a lot of ways.
Oh,
I mean,
very mental.
Yeah.
But it's also a social sport that you can continue to play as an adult. I still do. In fact, that text I just got is, someone who wants to play tennis tonight. So, it can still do that.
That's cool. I played tennis growing up, and when I moved to New Jersey, it was just different. I grew up in Atlanta, so I've lived everywhere, but and I was obsessed with tennis. I loved it. Mm-hmm. But when I went up there, it was like an indoor court, and it was all New Jersey-ish, and I was like, this is over. Okay. So I now I do a thing that I'm also a yoga teacher.
All right.
And that I hope to do forever, and I love to hike.
Uh-huh.
So I'm into the lifelong pursuits in that way.
Good.
I don't think you won't catch me running around on the cross field. No.
Yeah.
No thanks. Great. We have a great level here. Okay, so if first you could just introduce yourself, like your name and your title.
Okay. I'm Eric Wallen. I'm a professor of urology here at UNC.
All right, great. Thank you. Okay, so today we're going to talk about prostatitis. How do I say that?
Prostatitis.
Prostatitis. Okay, what is prostatitis?
Well, prostatitis is a spectrum of diseases that involves the prostate at the beginning, but also can involve other organs in the neighborhood as time goes on. And it can range from a rip-roaring infection with pus, which is probably not what we'll talk about for the most part today, all the way to something that's non-infectious and is more of an inflammatory process where the prostate is felt to be the origin of the disease, but then nerves and muscles and fascia covering the muscles gets involved over time and then becomes an issue even if the prostate is removed. It's a persistent problem.
Interesting. So it's like an infection that begins in the prostate, but then can move and sort of cause problems? I
would think of it more, the suffix itis means inflammation. It does not imply an infection.
Okay, cool.
So, an infection automatically brings about inflammation. So that's an obvious one. But the less obvious cases and the most common cases are the inflammatory ones that never involved an infection, or at least we can't ever identify that one ever took place. Those are the ones we see the most patients for.
Okay, so the most common one is some inflammation, not necessarily an infection. And then there's a more severe situation, which is like involving the pus, and that's less common.
Correct.
All right, cool. So yeah, why don't we focus on the one that's more common?
Sure.
So can you talk about? I mean, so let's see. So I don't want to totally neglect, but there's a severe kind. And what would be the symptoms of the severe kind?
The really severe ones would be associated with a high fever, people feeling truly sick, people going to the emergency room. That really an acute illness that is driving people to the emergency room.
Like appendicitis and other itis.
That's infectious. Yeah,
that's infectious. Okay.
Yeah, so that's usually infectious. But yeah, something that makes somebody so sick that they feel like they must go to the emergency room. The other ones are the ones where they want to see a doctor eventually for it, but they're not necessarily going to go to the emergency room. They're not feeling that awful.
Okay.
But it's more of I would describe it, the non-infectious prostatitis, as a constellation of symptoms. Mm-hmm. And when we have a constellation of symptoms in medicine, we call it a syndrome. And these symptoms can range from things that just start as prostate pain. Now, very few people can sort of sit still and say, well, does my prostate hurt or not? Because we're not normally aware of our prostate in any sensory way.
Right. I can't just focus here and try and concentrate.
Right. Where is my prostate tends to be the question most of the time. Okay. So men will come in and say, it hurts when I sit. Mm-hmm. It feels like I'm sitting on a golf ball, especially when I'm sitting for prolonged periods of time or a long drive. Or if I'm sitting at my desk for a long time, that kind of pain. Another kind of description that we'll hear is that there's pain in between the scrotum and the anus, with this area of the body that's called the perineum, because the same nerves that supply the prostate go to that area, which is more on the skin, although it's not a skin issue. Some patients will describe pain in their penis, with or without during or not during the act of urination. We also have patients who come in and say they have pain in one testicle or both, or it goes from one side to the other over time. I've also had patients who talk about having groin pain, kind of up above, in the pubic area on either side of the midline. And even some patients will talk about having rectal pain. So you can see it's in the neighborhood, but it's felt to be originating typically in the prostate.
Okay, so a discomfort in the pelvic area somewhere or another that's just like, okay, this is enough, got to see a doctor.
Right.
And okay, so how do you test for it?
So when a patient comes in like that, we already have a pretty good idea what's going on. But first and foremost, we have to rule out that there is a smoldering infection. Okay, so we'll check for infection first. So it's easy to do a urine test for that.
Okay.
After a prostate exam, which is a rectal exam, we'll also collect urine, and sometimes the infection will be manifest only after we've pushed on the prostate a little bit and kind of expelled some of the bacteria from the prostate into the urethra, which is then collected as a urine specimen as well. So if we can get a culture and identify a true infection, that's relatively easier to treat than when there's not an infection.
Okay, I don't want to get in the weeds on that, but if there's an infection, that's worse though, right? That's when we're talking about the worst kind?
Well, in between these two extremes, there's one that is called chronic bacterial prostatitis, where it's just kind of a low-level smoldering kind of a problem, and there is a bacterial source, so it is treatable with antibiotics. Many patients will have already seen, before they come to see somebody like me or somebody in our department for this problem, will already have been seen by a primary care doctor or maybe even an urgent care kind of a place and been given antibiotics, and they think it kind of helps. But then it comes back.
Okay.
It might come back a few days later, a few weeks later, even months later, and then they come and say, well, I have this prostatitis thing again, or I have this aching problem again. What do I do about it? And then we're unable to show, as we are in most cases, that there is an infection where there usually isn't. Okay? And then I get to start talking about it as an inflammatory process. And the inflammation, just like, if you feel like you have a bad knee that hurts more when it's about to rain or something like that, a lot of people will say that, or, that they have a bum shoulder. Those are inflammatory issues. It just happens to be that this individual has inflammation in their prostate.
Okay.
And it can come and go and get better and get worse.
Okay, so it seems like there's a spectrum of severity.
Yep.
And if there is an infection, in some ways that's easier to treat because you can give them the patient antibiotics.
Yep.
And then you hope it goes away. But let's say someone comes in and they've got the aching, and you do the urine test and there's not bacteria, so it's not an infection. How do you treat that?
Okay, so a number of things. First of all, I really focus on anti-inflammatories, the so-called non-steroidal anti-inflammatory drugs, or NSAIDs. They help knock down inflammation. So that's like... Sorry.
No worries.
Non-steroidal anti-inflammatory drugs over the counter, like ibuprofen, naproxen.
Okay.
There are stronger ones that are available by prescription, but those work just as well if they're taken at the right doses.
Okay.
So I focus a lot on the inflammatory component. Many men, particularly as they get into middle age and older, will have as a manifestation of their prostatitis problem urinary issues. So imagine the prostate's kind of swollen and inflamed. The prostate sits at the base of the bladder and surrounds the urethra like a donut, more or less. It's not quite that shape. With some swelling, urination might become more difficult because the channel is narrowed. So we have medications that can help with urinary symptoms as well. They're not anti-inflammatories. It's a different class of drugs altogether.
They make it so you can pee again.
They can help it. They can help it
better.
Yeah, better, right? There are other men where one of the manifestations is sexual dysfunction. So we'll treat them with anti-inflammatories and some of the medications that are available for sexual dysfunction, the Viagras and Cialises of this world. So that can help for those guys.
So sometimes it can cause like erectile dysfunction?
Yep.
And so you would then prescribe. So prostatitis can lead to being prescribed like Viagra.
Yeah.
Okay.
Yeah.
Interesting.
Sure can. I tend to really focus on the inflammatory piece of it with the patients because what I want as a goal of the treatment is for the patient to not only get better, quickly from, whatever's bothering them at the moment, but I also want them to know what they can and should reach for the next time it happens because it does wax and wane. It does tend to be something that recurs in patients. It's not one of these one and done phenomenon like an ear infection might be, right?
And that's
what drives men crazy.
Right,
I mean, I've seen men going on disability for this problem. And then others have a mild form that's just enough to be annoying.
Right.
When you're on a long car trip or when you'd rather be thinking about anything else, right? So they need to know what they can reach for in order to manage it when it kind of flares up again. So I talk about it being an inflammatory disease. It kind of smolders, then it can flare. How do you manage it? How do you knock it down? So I focus on that. I tend to get into a lot of discussions with men about what causes that, because a lot of the men who come in are worried that they might have cancer, either testicular cancer because their testicle hurts, or prostate cancer because their prostate hurts. So I spend some time trying to talk about that, telling them that usually isn't a manifestation of any of these malignancies. But then it's an opportunity, number one, to screen patients for these diseases if it's appropriate, and two, to get into some lifestyle things that really help with inflammation.
So preventing flare-ups.
Yeah. I think it's very interesting to talk to patients about it as the pelvic version of a tension headache. So a tension headache, when people say, I got this headache, it's a tension headache, it's often due to like muscular tightness in the neck.
Right. I'm living that right now.
Due to stress. Like right now?
Not right now. Not right now, but I'm on muscle relaxers right now because my neck was pulling the curvature out of my cervical spine. I got all chiropractors. I got a bunch of people on the case. But so I can really relate to that
okay.
analogy.
So a lot of men can. So when I put it in those terms and I talk about treating it as an anti-inflammatory thing, it also leads readily to me asking them questions about stress in their lives. Because this can be a manifestation of stress. And a lot of the guys I see tend to be type A's, high stress type guys, or work in very high stress environments. And if I can get them to address that, a lot of times their prostatitis symptoms will actually improve. And I think it's fascinating. Yes, it's really interesting stuff. So I talk to them about stress directly. And it's probably the first time any physician has had that conversation with them about stress.
It's kind of profound.
Yeah, because men are men, right? Men work hard, men play hard, men go hard. It's really intense. And if we can kind of dial down the stress, then maybe there'll be fewer physical manifestations of that. I've told patients to do relaxation. I've told patients to do yoga. And it has been a game changer for many of the patients. And this is not, I'm not making this up. It's not like this isn't without some evidence. There have been studies done when a voltage meter, believe it or not, has been placed in the rectum of men who have prostatitis and measured the muscle tension in volts. It's not high volts, obviously, but it's something measurable, and compared to normals. And prostatitis type sufferers had higher voltage, had higher muscle tension, measurable.
This won't go into the podcast, but does that mean they're like tight ass?
What?
Is that like they're like tight ass?
Yeah, uptight. Yeah.
Uptight, okay.
Yeah. Turn some carbon into a diamond.
Anal retentive. Is that
yeah.
Okay. Yeah.
It's all the same. Yeah. It's
interesting. Measured in
really
voltage.
Interesting. So the person I know who studied this was, 20 years ago. He then had patients do biofeedback, which is, teaching them how to manage their thoughts and manage their stress while looking at that voltage curve. And they lowered their voltage, and they came back for multiple treatments, and their symptoms got better. No medication, nothing. So if we can address the stress piece that is causing some of this muscle tension in the pelvis, a lot of times we can improve patients' symptoms.
Do you find that since a lot of the men, so I can tell you, I have two friends who have this, they're both totally that, type A, really hard workers, like really intense. And so I wonder, do you find when men come in and they hear you say, let's talk about the stress in your life, do you sense like, I don't know, like a relief or like I think a lot of men have a hard time sort of opening up about that and being sort of vulnerable. Do you find that because it's coming from a medical doctor that it's like, finally I can sort of like let my guard down a little bit?
Yeah, definitely some of that, right? Mm-hmm. But I've also had, their private parts in my hand recently, right before I start talking that way. So they've already been, vulnerable enough to come to me and pull their pants down for an exam. But yes, I think the word that is used these days is it resonates with them, right? Mm-hmm. They say immediately, oh yeah, that's true. I get it. It's worse when it's worse at work. It's better when I'm on vacation. And then we talk about how to, bring the vacation a little bit closer to home with, even short-term relaxation exercises, getting in a jacuzzi or a hot bathtub, things that will just get some of the muscles to relax will be something that patients can use as tools.
I had no idea this was going to go this way. I think it's so interesting. But speaking of preventing flare-ups, so aside from the stress, are there some other things, some lifestyle changes you suggest?
So a lot of times there are dietary things that can make the symptoms worse. And I ask patients to write down when they've had a bad day or a bad week, kind of what was going on. Were they eating out a lot? Were they eating more spicy food? And sometimes people identify something in their diet. Sometimes more acid foods or acidic foods will do it. But I haven't had a lot of success with that.
What about booze?
Booze, I can't say that it really makes a difference one way or another because when you drink alcohol, it's actually a muscle relaxant too, right?
Right.
So in many ways that may help people. So I don't know. Sometimes coffee will do it, but I haven't seen it be a problem with alcohol.
I think that people drink, get home. This is how like people get alcohol problems, right? They come home, they want to de-stress, they drink something, but actually there's a cumulative effect where that actually causes stress. So I wonder if there's a like alcohol will actually increase your anxiety over time, according to someone in the elsewhere on UNC. So I don't know, that might be something. Hey,
what an interesting clinical study that would be. We would have lots of volunteers for that kind of a study, right? Yeah, that would be really interesting.
Yeah, pizza and beer.
Yeah.
Cool. Okay, so if someone like in our area is having some symptoms, what can they do to like make an appointment? Should they talk to their primary care physician, or can they make an appointment directly here, or how does that work?
Well, I would start with some first self-examination based on what I'm saying, right? So ask about stress in your life, ask about things that you can do that might cost you 5 minutes a day or less that can help decrease stress. Ask yourself if you're that kind of person who would benefit from that. I would try over-the-counter anti-inflammatories and see if that helps. And if all else fails, talk to your primary care doctor. We have pretty clear algorithms that exist also in primary care for the management of these symptoms, right? So I think it's probably worth going to a doctor to make sure that there's nothing more serious and dangerous going on, right?
Because that could be stressful in and of itself.
Right.
Like, do I have cancer?
Right. So do I have an infection? Do I have cancer? Is there microscopic blood in the urine that would merit a workup for that kind of a problem? Have I ever peed blood? That's a major concern. So those things do need to be evaluated. They can be evaluated probably most efficiently in the primary care setting, and then patients get referred on to us, especially after they've had a couple rounds of treatment, at least sort of the first line and second line treatments for prostatitis, and then we can talk more with them about what else is available.
Thank you so much for talking with me today. This has been very enlightening.
Good. It's been a pleasure.
So